Good evening, student. Today we shall talk about inflammation. Why inflammation? Almost more than 90% of cases that we come across in our day-to-day practice is related with this single pathology, that is inflammation. For example, tonsillitis, inflammation, myocarditis, inflammation, myocardial infarction, inflammation, urethritis, arthritis, rheumatoid arthritis, dermatitis, and many more. So, in order to understand the basic pathology of all such diseases, one must understand what inflammation is. Let's start today to understand this topic, inflammation. Inflammation is derived from the Greek word inflare. 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 It means burning out. The characteristic feature of inflammation is pain and burning sensation. Is it pathological? It may be. But what is inflammation? It is a non-specific response. Non-specific response. Non-specific response of the host defense mechanism to the noxious agent. Now, few words we need to understand. Inflammation is a non-specific response of the host defense to the noxious agent. Now, the agents which are responsible for inflammation can be classified into biological agent, mechanical agent, physical agent, chemical agent, agents of inflammation. The noxious agent can be classified into biological agent, chemical agent, mechanical, physical, immunological, nutritional imbalance, so biological agent includes bacteria, viruses, fungi, parasite, protozoa, and so on. All the microbes comes under biological agent. Chemical agent includes sodium, potassium, glucose, concentrated acid. Mechanical agent includes trauma, extreme cold, heat. All this comes under mechanical agent. Ultraviolet radiation. Physical agent includes trauma basically. And immunological agent includes antigen antibody complex formation in diseases such as rheumatoid arthritis. Apart from this, death and necrotic cells can trigger inflammation. Always remember this. dead and necrotic cells can trigger inflammation. These are agents which are responsible to trigger inflammation. Now, types of inflammation. Inflammation, depending upon the duration, can be distinguished into two main groups: acute inflammation and chronic inflammation. Types of inflammation. Depending upon the duration, it can be classified into two main types: acute inflammation and chronic inflammation. Acute inflammation starts within hours and may last for few days. Say for 24 to 72 hours. While chronic inflammation starts after few days and may last for months or year to continue. Chronic inflammation. The cell which is predominant in acute inflammation is neutrophil. Always remember this. The cells which are predominant in acute inflammation is neutrophil. Why? In case of chronic inflammation, lymphocytes play a major role. It has got the onset of sign symptoms is rapid, while in chronic inflammation the onset of sign symptoms are gradual, but it lasts for longer duration. Right? Now, let us consider what happens during inflammation. This is surface of skin. A trauma is caused due to an infected nail. Let us consider this as an infected nail. We have got a blood vessel. Let me draw like this. The blood vessel has got endothelial, just below the surface of skin we have got mast cells which has got granule sac-like structure which contains histamine. This is mast cell. We have got macrophages. Macrophage. We have also got dendritic cells. All these act as a watchdog to any pathogen which enters below the skin. Now, as there is a trauma, there is breach in the integrity of skin. There may be an invasion of pathogen. A pathogen, let's consider this individual pathogen. A gram-negative bacteria enters this area, tissue space, right? This has got antigenic surface. Antigenic surface means this pathogen has got antigenic surface That means it can act as an antigen to trigger antigen antibody reaction or to promote the further development of action caused by immune cells. Immune cells basically leukocytes. It has got antigenic property on its surface. This may be a glycoprotein, a polysaccharide, a protein, anything which can trigger immune response. In our case, let us consider this as an gram-negative bacteria, right? Okay. Now, inside the vessels, we have got neutrophil. We have also got monocyte, RBCs, platelet, and along with this we have got complement protein and plasma kinins. Now the steps involved in inflammation are: first, recognition, then recruitment. I shall let you know as the lecture progresses what does this means. Just understand the recognition, recruitment, repair. These three words are important: recognition, recruitment, followed by repair. Right. Now, inside the blood vessels, we have got leukocytes. During acute inflammation, the main immune cells which participate is neutrophil. Within first 24 to 48 hours, neutrophil play an important role, followed by monocyte. Now, as soon as this nail pricks your skin, the skin which was intact is damaged. The cells around this are damaged, and it releases certain chemicals. The damaged cells releases certain chemicals. Now, these chemicals binds or activates the mast cell. The chemicals released by the damaged cells activates mast cells. This is mast cell. This we have got macrophage, and this is dendritic cell, DC. Right? Now, the immune cells are within these blood vessels. This won't help us. We need the immune cells at the site of injury, at the site where the bacteria is present, right? So there has to be a certain mechanism that the immune cells migrate from the vessels to the extravascular space in order to eliminate this bacteria, right? Now, can the immune cells migrate directly? The answer is no. The endothelial cells are intact, the endothelium is intact. There is no space through which this neutrophil can migrate, right? So what is the mechanism which is responsible for migration of neutrophils to the site of injury? Let us understand that. This chemical activates the mast cell. The mast cell in turn releases on activation releases certain chemicals. What are these chemicals? We shall look into that. The mast cell, what I said, contains histamine, right? It has released into the open space. The sac ruptures, the histamine is released into the space near to the tissue injury. So mast cell also releases, along with histamine, serotonin and bradykinin. These are potential chemical mediators, inflammatory mediator. So what is the role of histamine? Histamine, the blood vessels has got smooth muscles, right? Smooth muscles lines the blood vessels. Now, histamine causes relaxation. The histamine binds on the smooth muscles and causes relaxation of the smooth muscles of the vessels. This leads to vasodilatation. This leads to vasodilatation. Let us understand this. Histamine causes vasodilatation and increase in vascular permeability. Similarly, serotonin and bradykinin also act in the same way. It causes vasodilatation plus increase in vascular permeability. Now, if we look at this, there is an opening of space here and here, close to the site of injury. This mechanism doesn't occur throughout the body, right? It has to happen close to the site of injury because we need immune cells to eliminate this bacteria. Now, in order to simplify, we are just considering a single neutrophil, right? Neutrophil. Histamine, serotonin, bradykinin causes increase in vascular permeability plus vasodilatation. Now, two events of inflammation, right? It is classified into two main groups, that is vascular event and cellular event. The vascular event involves increase in vascular permeability and plus vasodilatation. Now, once there is a vasodilatation, why do we need vasodilatation? Under normal circumstances, the cells, neutrophils, leukocytes, platelet, RBC, has got axial flow, central flow, and has a flows with certain speed. Now, in order to slow down, we need to slow down. We need WBC or the neutrophil to escape this and reach to this pathogen, right? So, in order to decrease the speed of these cells, there is a vasodilatation. Vasodilatation results in stasis. Stasis. Vasodilatation results in stasis. It slows down the speed in which the leukocytes are moving into the blood vessels. Right? That is stasis, causes stasis of the blood and plasma fluid. Right? Now, we need to increase the vascular permeability. Why? Because if this space remains closed, the neutrophil will not be able to reach to this site. So we need this space to be opened. Right. Now, the increased vascular permeability, with the increase in vascular permeability, the plasma fluid leaks to this space. The plasma fluid leaks into this tissue space along with leukocyte, erythrocytes and cells, immune cells. What this causes is swelling. What are the main features of inflammation? Rubor, calor, dolor and tumor plus loss of function. Rubor means redness. Due to vasodilatation, there is a stasis of blood at that area. This causes redness. Now, calor means rise in temperature. As there is blood, more pooling of blood at that site of trauma or at the site of entry of injurious agent, the pooling of blood causes rise in temperature. Dolor is pain. As the fluid escapes the blood vessels, it causes stretching of the nerve endings which are present beneath the surface of skin. This stretching or irritation of the nerve ending causes pain. Tumor. The pooling of the blood outside the vessel causes swelling. This is tumor. Rubor, calor, dolor, tumor and loss of function. Right? These are characteristic features of inflammation. Rubor, calor, dolor and tumor. So, let us now consider vascular event in details. We shall now concentrate on vascular changes. This is site of injury. Now, the chemical released by mast cell, that is histamine, serotonin and bradykinin. Mainly we shall talk about histamine. Histamine causes vasodilatation and increase in vascular permeability. The vessel dilates and there is increase in vascular permeability. What we have seen inside the blood vessels, the neutrophils, monocytes, RBC, all has got axial way of running inside the blood vessels. Now, in order to neutrophil to reach at this site where the pathogen is present, it has to slow down, right? So the slow down process is achieved by vasodilatation and increase in viscosity, because there will be concentration of cells, concentration of RBC, because of stasis, vasodilatation. So the slow down process is achieved by vasodilatation. Now, we have got macrophages which reacts to this antigen, and it also secretes two important chemicals. Please remember this, two important chemicals, that is TNF alpha, tumor necrosis factor alpha, and IL-1, interleukin 1. What this causes, TNF alpha and interleukin 1 acts on this endothelial surface. TNF alpha and interleukin 1 act on this endothelial surface and it produces a protein on its surface, that is selectin. This protein is known as selectin. Now, I shall just consider one neutrophil for simplicity. We have got this neutrophil. Now, there is a counter protein on the surface of neutrophil. Now, this neutrophil binds to this ligand, right? And then it rolls from one side to another. It keeps on rolling from here to here, from here to here, right? This is not a strong bond. This is a weak bond. Now, in order to escape through this space, there has to be a strong bond. There has to be some holding of neutrophils, right? At this space. This is achieved by formation of another protein, that is integrin. This is selectin and this is integrin. There is a release or there is a formation or projection of another protein, that is integrin. Now the production of integrin on the surface of neutrophil doesn't occur except when there is a sign of inflammation or there is some noxious agent entering into the body. So once the noxious agent enters the host, then due to the release of tumor necrosing factor and interleukin 1, there is formation of integrin. Now this holds on the neutrophil very tightly. This holds the neutrophil very tightly to the endothelial surface. Followed by the neutrophil then escapes through this area by squeezing itself. Right? Here is the pathogen. The neutrophil escapes through the opening between the endothelial cells. It secretes certain chemicals which dissolves the basement membrane of the blood vessels. Now, the neutrophil then reaches at the site where the bacteria is present. Let us understand this. Let us please understand the steps involved for the immune cells to reach to the site of injury. First is margination. Remember this word. First, margination. Number 2, adhesion. Number 3, diapedesis. And number 4, chemoattractant or positive transmigration, or is also known as chemoattractant transmigration. First is margination. What we have seen is the neutrophil or the immune cells are running in the center, right? But in order to take a left turn, the neutrophil has to move close to this endothelial surface. This is termed as margination, and this is achieved by vasodilatation and stasis of blood. Next is adhesion. A strong bond is formed between the integrin and selectin. It holds on. The neutrophil is caught by the endothelium. This is adhesion to the surface, right? Followed by squeezing of neutrophil. The neutrophil squeezes out of the blood vessels. This is diapedesis. And next is chemoattractant or transmigration. Migration of neutrophil from the blood vessel into the tissue space. This is transmigration. Right? Now, the vascular event is necessary for the cells, immune cells, to reach the site of injury. We shall stop this lecture right now and then we shall try to understand what are the further development. But What we have learned today is inflammation is a non-specific response of the host defense mechanism to the noxious agent. Types: acute and chronic inflammation. Steps involved: this is recruitment. First was recognition. This pathogen was recognized by the mast cells or by the macrophage. Right? Recognition, then followed by recruitment of WBC. This is recruitment. We need WBC to at this pace. Our Indian army is present at the LOC. They are not inside Nasik or Bombay, right? So this has to be here. This is recruitment, and there are series of steps that takes place for the neutrophil or the monocyte to reach at the site of injury. Number 1, margination. Number 2, adhesion. Number 3, diabetes. Number 4, chemoattractant or transmigration. Right? Thank you.